Thank you for watching New Day here on CNN Philippines. Now, it is said that the sense of hearing is the most powerful and essential among the human senses. It perceives music, speech, and environmental sounds that help us function in our everyday life. That's why it's important that we know what to do and where to go when we experience hearing problems. Now, with us this morning to talk about hearing care is Dr. Liza Abaño-Robles, AUD, American Board of Audiology International Certified. She's also the General Manager of the Manila Hearing Aid. Good morning, Doctora, and thanks for joining us. Obviously, it's great to have you here early in the morning. If a person starts to notice early signs of hearing loss, and it's inevitable, as we were
Yes.
talking about off-cam, as a hearing care specialist, what can you recommend? What tests should we be doing, and what should we be looking out for as early signs?
All right. Early signs usually include like when people are when you're talking to someone and they're like always asking you to repeat what is being said, and they always say ha, or like they go like this, or they point out their ear to you, or they turn up the volume of the TV loud.
That's quite often I notice when I visit my elderly relatives.
Yes.
When I come into the room, I'm like, wow, their TV is on so super loud.
Yeah.
And maybe it's something that sort of gradually sort of creeps in without us taking much notice of.
Yes, that's true. In fact, there's a study like there. Sometimes it takes about 10 years for a person to really seek that hearing, to seek hearing evaluation.
Okay.
Yeah.
Now, you guys are the pioneer. You've been around since 1973?
76.
76?
We started 76.
And that's certainly a lot of history there. Where did you guys begin? How did you come into the scene? And what have you really been doing to remain on top of
the hearing care
industry?
Yeah. Well, in 1976, around the time, my father, Dr. Liza Abaño, who was the founder of the company, he came, fresh from his stint in New York. He studied ENT there. And when he came back here, he found out that there's no hearing care services comparable to what he trained in New York.
Right,
Yeah,
okay.
so that's how it started. And, we have a legacy of first, actually we were the first hearing care center to be recognized by the Board of ENT, the Philippine Board of ENT.
Right.
And just like, all the technology, the products, the services that we started to offer back then, I mean in the 70s and the 80s,
Right.
there's just...
All the way to today.
Yes,
So it's fantastic that we have expertise such as you guys, or your expertise, that we can count on to help us with these problems. Now, what kind of tests should we be looking at if we start to notice or notice somebody amongst our loved ones who may be experiencing some hearing problems?
We have different tests, but actually we need those accurate tests, diagnostic tests, to be able to know how to manage somebody with hearing loss or even without hearing loss.
Right.
So we have hearing tests like pure tone audiometry, speech audiometry. We have objective tests like auditory brainstem response tests, those newborn hearing screen tests like autoacoustic emission tests. We have different kinds. But really the first step into knowing how your hearing is to have that accurate diagnostic hearing test.
Right. And oftentimes it's something that we don't really like to admit to ourselves, or oftentimes our loved ones don't particularly care to admit that, hey, maybe I've got a little bit of a hearing deficiency.
There's a stigma.
Yeah, there's a stigma to wearing a hearing. Hey, look at this. to wearing.
But this actually is changing right now.
Right.
As we see people wearing those earbuds. So it has slowly evolving into a lifestyle actually. Hearing wellness actually.
There
it's
you
not
go.
anymore
That's
hearing
really
loss.
what we should be looking at,
It's hearing
or
wellness.
sort of changing out the way we think about it. Now, listen, Doctor, there's a lot of things nowadays that sort of, contribute maybe to problems with our hearing. We're often with headphones, earbuds. We often don't pay attention to how loud we may be playing that music, and also environmental noise may be adding to that pollution. What are some of the factors that accelerate problems with our hearing?
Oh, definitely. If you're exposed to a lot of noise, like for example, let's say if you work in a very noisy place, and there's actually a recommended decibel level that if you're exposed to really loud noise.
The entertainment industry, the music industry, construction sites, there's so many things.
And also music, there's actually what we call noise-induced hearing loss. There's actually, in the recent years, what we term music-induced hearing loss.
Okay, yeah, because when I'm with my kids, sometimes I'm about this far, and I'm like, I can hear your music. I don't think that's good for your ears.
Yes, actually, there's in the studies, if somebody's wearing earphones, right, And if you can hear their music that's really loud, or if you actually talk to them and they're not responding, if you talk to them at your normal conversational level and they're not responding, then the volume is actually very loud.
Okay, basic ear care. What should we be doing? Is it in fact good to clean your ears every day? I see and hear differing opinions on this. Let's settle this once and for all. Should I be cleaning my ears every day with an earbud? Is that a good idea?
Actually, it's not good to clean it with earbuds because the tips is actually scraping off the skin in the ear canal. It's actually very thin skin.
And if you're not doing it right, you're actually driving more of that dirt in there, right?
Yes, yes.
Okay, so how should we go about it? What's the best way?
Actually, earwax is naturally pushed out of our ear canal. So you're really just supposed to really wipe it. Wipe only the outside.
Okay.
The outside of the ear canal. It's not really advisable to stick, earbuds, especially.
Because guilty as charged. I mean, I thought that was what you were supposed to do, and I'm sure a lot of viewers may be doing that. We're seeing some video now of people who are, you can get pretty vigorous with the way you clean your ears, and you may not be doing yourself any favors.
Yeah, because the skin around the ear canal inside, it's thin.
Okay.
So if you're always scraping it, then you have, the danger of scraping it too much, and it can get wounds there, it can get bacteria in there. But earwax is there because it's not there's actually hair inside the ear canal.
Okay.
With the earwax, it naturally pushes out, debris that's stuck in there.
Okay, something to keep in mind. All right, obviously you guys, like I said, you guys have been around for quite a long time. You are the leaders and pioneers in the hearing industry. What are your future plans, and how do you intend to, keep moving forward with the times?
All right. Of course, we plan to expand. We have several clinics, retail clinics around Metro Manila and a few in the provinces. Yeah. And we actually have partners also around the country. Well, expansion plans, just putting more, hearing clinics and, of course, promoting hearing wellness. It's not promoting how to manage hearing loss, but hearing wellness, because it should really start from there, It's like taking care of your eyes. It's really taking care of your ears, because if you cannot hear, then you will have a difficult time communicating.
Yeah.
And if you have difficulty communicating, it can cause stress. And as we all know, stress is the cause of many chronic disorders.
Absolutely. You don't want to.
And you can also feel, if you cannot communicate, you can also feel isolated. And sometimes you see that people can't hear well. And they just keep quiet at the back, when there's conversation. You lose out.
Yeah, it's something, like I said, it's something that we don't usually pay enough attention to. But really, I love the way you've turned it. Hearing wellness. That's something that we really should be taking
what we're trying to promote
closer look at. Now, listen, Dr. For the benefit of our viewers, where do we go if they want to know more about Manila Hearing?
Well, aside in the retail clinics around Metro Manila, all right, in major malls. You can go to our website, which is www.manilahearingaid.com.ph. And of course, we have our Facebook and Instagram accounts.
There you go. Yeah. Okay, thank you so much to Manila Hearing Aid General Manager, Dr. Liza Abaño-Robles, AUD. Thank you so much, Dr.
Thank you very much, Paolo. Thank you.
A blockbuster tray of the PBA Days